Sure, and I'll be as brief as possible, but nuclear proliferation is a problem in itself, and it's serious, and I respect Lee Hamilton enormously. But my friend, the real disease is radical Islamic extremism, that if these nuclear weapons fell into their hands and they were able to move them into the United States of America or other countries, we have to do everything we can to make sure that technology and weapons themselves are kept under strict control and disarmed. But my great fear, and most every national security expert that I know, is the nuclear weapon falling into the hands of a terrorist organization. That's our reason for great concern about Iran today. If we didn't have these terrorist organizations in the world, at least these nuclear weapons might be in the hands of more stable governments or governments we can deal with. If the Iranians develop a nuclear weapon, my friends, I'd like to give you a little straight talk. That my fear is not that they put it on a missile aimed at Israel. My fear is that they give it to Hezbollah or Hamas or other terrorist organizations, and then obviously the consequences are incredibly catastrophic. With all due respect to Lee Hamilton, I agree that that's a major issue, but the threat of radical Islamic extremism and the terrorist organizations they spawn is more of the problem in my view. I'd just like to, and I'm sorry for the long answer, the threat of the 21st century, my friend, is a struggle against radical Islamic extremism. It is military, it is diplomatic, it's intelligence, and it's ideological. Somehow, Osama bin Laden a couple of weeks ago was able to get a message out from some obscure place in Afghanistan or Pakistan that reaches billions of people. They are making where he recruits, instructs, and motivates this radical Islamic extremism. We're not winning the battle in cyberspace, and we better do a lot better job. These young people, if right after 9/11 you'd have told me, we'd have had a discussion, I said, by the way, there's some doctors in Glasgow, Scotland, doctors, who got on, heard a radical message from an imam, and then got on the internet and got together and became such extremists they want to become suicide bombers and blow up the airport in Glasgow, Scotland, you'd have said that's an unlikely scenario. We won the Cold War not by a tank battle in the plains of Western Europe. We won the Cold War by winning the ideological struggle, by holding out the hope of freedom and democracy and a better life for people behind the Iron Curtain. We've got to convince these same people all over the world that we are the force for good, and the people that are trying to motivate them are the greatest force of evil that maybe in some respects this nation and our Western civilization, our Judeo-Christian principled West has ever encountered. Yes, sir. Well, I'd like to point out that's another special interest group that doesn't give me any money. Look, everybody knows we need tort reform. Everybody knows it. I was with the president in 2004 in Nevada. We met with a group of physicians who were OBGYNs. They were saying that all the OBGYNs were leaving that state and going to California because there was simply their malpractice premiums were too high. They couldn't afford to practice. Isn't that terrible when if a woman has a gynecological OBGYN problem that she has to go to another state to get treatment? And there's no doubt that the skyrocketing costs of malpractice and insurance premiums are way too high. And that's why I specifically mentioned it in my comments. It has to be reformed. I know the trial lawyers are very powerful, particularly with the Democrats. I mean, it's just a fact of life. But I think American people have probably had enough, and I think we can rally the American people to get reasonable medical malpractice reform, because it's got to be part of any solution. And one other additional comment, that you also know, and that is because of some of these problems and difficulties, we are starting to see a decline or a disinclination on some of our brightest and most intelligent young people to enter the medical profession. That would be a terrible thing to see happen. Yes, sir.
I'm a chiropractor here in town, and the biggest thing I see from people is that they take their health for granted, and they say to themselves, like all the time, like, it's not going to be me, I'm not going to get sick, I'm not going to get cancer, I'm not going to get heart disease. The 5 out of 6 Americans are dying of heart disease or cancer. Just when is that going to happen? So it's just got to become your own belief. We got to stand up as a nation and just focus on our own health. We're 38th overall in world health right now. In the last stats I saw, when we have these countries that they really focus on their health instead of just waiting for symptoms to just come from. You can't base your health on symptoms and then take pills. And we have commercials coming at us talking about all these different potions that we can take. And we're only 5% of the world's population. But the last stats I saw that we take 60% of all the drugs. So that's just I don't know what your idea is on that.
Well, first of all, your initial point is correct. The Japanese spend half the amount of money that we spend on health care, and they live longer. The same is the case with the Europeans, which means, my friends, we have a broken system. We still have the best medical care in the world. Whenever some wealthy person in the world gets sick, they don't go to Japan. They come right here to the United States for treatment. So I think we should always keep that in mind. We've got a tremendous job in education. Look, in the days when state governments actually complied with the agreement that they made with the tobacco companies and took that money and spent it on the treatment of tobacco-related illnesses and education as to the use of tobacco before they started just betraying that agreement and using it for general revenues, tobacco use was on the decline in America. Now, of course, in some places it's back up because the states have basically broken their agreement and used that tobacco tax money for other revenue purposes. A disgrace, by the way. But education is important. Wellness and fitness is important. It obviously is. I'm sure you know, 75% of the healthcare costs in America go to the treatment of 5 chronic diseases: heart disease, diabetes, etc. And so clearly we see obesity on the rise. Unfortunately, a lot amongst young people, and it's been widely publicized. It's time we went to work. It's time we went to work and educated people and made parents responsible, and started these programs in the schools. And also, by the way, we ought to look at the overall physical education curricula in our schools as well. There are too many schools in America today where there basically is no physical education required for the students in that curriculum. But I believe it's an education problem. But I also want to tell you, finally, once they reach the stage where they need care for those diseases, we as a society have to take care of them. And we have to do it in the least expensive way, in the most effective way, and frankly, the most caring way. And that's just a reality of the kind of nation we are. The question is, are we able to do it efficiently, market-based, private incentive, most effective, or do we want a big government solution, which frankly hasn't worked in anything else that I know of, and I'm sure that a visit to Canada or England will tell you the benefits or the non-benefits of a single-payer big government system. Yes, sir.
I noticed in your speech you avoided any comparison of your plan to Hillary Clinton's plan. I'm curious, have you or your staff put a price tag on what you see coming out of her campaign for Hillary Care?
No, but there's many things that concern me about it. It's vaguely, not vaguely, but eerily reminiscent of what they tried back in 1993. I think they put some lipstick on the pig, but it's still a pig. And second of all, it is the liberal outlook. Let government do it. That's the ultimate solution. I haven't examined all the details of the plan, but it is the big government system with mandates.